What if I told you that something happening inside your body, something you can't see, can't feel, and can't control, is actively damaging your teeth and gums right now? I'm not talking about sugar. I'm not talking about coffee or cigarettes. I'm talking about your hormones. Most people brush twice a day, floss occasionally, okay, maybe rarely, and think they're doing enough. But your dentist might never have told you that when your hormones shift, your entire oral environment changes with them. Teenagers get mysterious gum inflammation. Pregnant women lose teeth they never expected to lose. Menopausal women suddenly develop burning mouth syndrome, and stressed out adults grind their teeth into dust at 2 a.m. All of this connected to one thing: your hormonal system. Today, we're breaking all of it down. Stick with me, because by the end of this video, you will understand your mouth in a way that most people, including a lot of healthcare providers, simply don't. Section 1. The hormone-mouth connection. What's actually going on? Alright, let's start with the basics, but I promise we're going to go way deeper than your high school biology class ever did. Hormones are chemical messengers produced by glands throughout your body. Your adrenal glands, thyroid, pancreas, ovaries, testes, and more. These tiny molecules travel through your bloodstream and tell your organs what to do. Now here's what most people don't realize. Your mouth is extremely sensitive to hormonal signals. Your gum tissue, called the gingiva, has specific receptors for sex hormones like estrogen and progesterone. That means when those hormone levels rise or fall, your gums literally respond. They become more inflamed, more permeable, more vulnerable to bacteria. And the research backs this up. A study published in the Journal of Periodontology found that hormonal fluctuations directly alter the immune response in gum tissue, making the gums overreact to plaque that they'd normally handle just fine. So it's not just about hygiene, it's about your biology. And once you understand this, a lot of things start to make sense. Section 2. Puberty, when it all starts. Let's go back in time for a second. Think about puberty. Between roughly ages 10 and 14, the body starts producing surging levels of estrogen in girls and testosterone in boys. And along with acne, growth spurts, and all that awkwardness, the mouth starts changing too. Dentists actually have a name for it: puberty gingivitis, and it's incredibly common. During puberty, increased sex hormones cause blood vessels in the gum tissue to dilate and become more reactive. Even a small amount of plaque that the gums might have ignored before, now triggers redness, swelling, and bleeding. One study in the Journal of Clinical Pediatric Dentistry found that gingival inflammation peaks right alongside the hormonal surges of puberty and gradually decreases once hormone levels stabilize. Now here's something really interesting for teens or parents watching this. Some adolescents also develop what's called puberty epules. These are benign, localized growths on the gums. They look alarming, but they're actually a direct response to hormonal stimulation of gum tissue. They usually resolve on their own once puberty passes. Also worth mentioning, testosterone in teenage boys has been linked to increased saliva production, which can actually offer some protective effects. But higher testosterone also correlates with higher risk-taking behavior, meaning teens may be less consistent with oral hygiene, so the risk evens out either way. Bottom line for puberty? This is the time to double down on oral hygiene, not skip it. The hormones will pass. The damage from ignoring gum disease at this stage, that can last a lifetime. Section 3. Pregnancy, the oral health crisis nobody talks about. Okay, this next section is something I consider genuinely important. If you are pregnant, know someone who is or ever plan to be, pay close attention. Pregnancy is one of the most dramatic hormonal events the human body can experience. Progesterone levels can increase up to 10 times their normal level during pregnancy. Estrogen spikes as well, and these changes do not spare the mouth. Pregnancy gingivitis affects somewhere between 60 to 75% of pregnant women in the United States. That's not a small number, that's the majority. Here's what happens. Those elevated progesterone levels cause gum blood vessels to become hypersensitive to bacterial plaque. The immune system also undergoes changes during pregnancy to prevent rejection of the fetus, and one consequence is that inflammatory responses in the gums get amplified. But it gets more serious than swollen gums. Research published in the American Journal of Obstetrics and Gynecology found associations with severe gum disease during pregnancy and preterm birth, low birth weight, and even preeclampsia. The proposed mechanism is that oral bacteria and the inflammatory compounds they trigger can enter the bloodstream and affect fetal development. Now, correlation isn't always causation, and research in this area is ongoing, but the American College of Obstetricians and Gynecologists does recommend that pregnant women maintain dental care throughout pregnancy. There's also a condition called a pregnancy tumor, or pyogenic granuloma. Don't let the name scare you. It's not cancerous. It's a benign growth that typically appears on the gums between teeth during the second trimester. It bleeds easily, looks traumatic, and usually disappears after delivery. And then there's the morning sickness factor. Frequent vomiting exposes the teeth to stomach acid, which can erode enamel. Dentists recommend rinsing with baking soda and water solution after vomiting, not brushing immediately, because brushing while acid is present can accelerate the erosion. Pregnancy is a time of incredible change. Your mouth is part of that change. Don't put dental care on the back burner just because you're growing a human. Section 4. The menstrual cycle, monthly mouth changes. Here's something that might genuinely surprise you. And honestly, a lot of doctors and dentists don't bring this up enough. Your menstrual cycle affects your mouth every single month. In the days leading up to menstruation, the late luteal phase, progesterone levels peak and then drop sharply. During this hormonal fluctuation, some women experience what's called menstruation gingivitis. Gums become red, tender, and bleed more easily. Some women notice canker sores or cold sore flare-ups around this time as well. This happens because the elevated progesterone right before the period makes gum tissue more reactive, while the immune system shifts focus to prepare for menstruation. Interestingly, women on oral contraceptives, birth control pills, used to experience this even more intensely with older formulations. Modern low-dose contraceptives have reduced this effect significantly, but it's still worth knowing. A 2021 study from the Journal of Periodontology also found that ovulation mid-cycle corresponds with a detectable dip in saliva pH and a change in the microbial composition of the mouth, meaning even ovulation subtly alters the oral environment. For women tracking their health, this is genuinely useful data. If you notice your gums being more sensitive at certain points in your cycle, you're not imagining it. It's biological, and it's your body telling you to be gentler and more attentive with your oral hygiene during those windows. Section 5. Menopause, the hidden oral health storm. Menopause is one of the most misunderstood transitions in women's health, and its effects on oral health are almost never discussed in mainstream conversation. When estrogen levels drop sharply during menopause, the consequences for the mouth are significant. First, bone loss. Estrogen plays a critical role in bone density. When estrogen drops, the jawbone can begin to lose density, which destabilizes teeth. Studies have found that postmenopausal women have a significantly higher risk of tooth loss, not because of poor hygiene, but because the jawbone supporting their teeth is literally thinning. Second, dry mouth or serostomia. Estrogen influences salivary gland function. As levels decline, saliva production often decreases. This is a serious issue because saliva is your mouth's first line of defense. It neutralizes acid, washes away bacteria, and helps remineralize enamel. Without it, cavity risk skyrockets. Third, burning mouth syndrome. This is a condition that causes a persistent burning or scalding sensation in the mouth with no apparent cause. Research links it to hormonal changes at menopause. According to the Menopause Journal, up to 15% of postmenopausal women report oral discomfort consistent with this syndrome. Fourth, taste changes and altered oral sensation, which can affect diet and nutritional intake. The good news? Hormone replacement therapy, HRT, has been shown in several studies to reduce the severity of these oral symptoms, including reducing bone loss risk. But HRT is a complex medical decision, and that's a conversation for your doctor, not just your dentist. What's actionable right now? If you're in menopause and notice dry mouth, bone sensitivity, or unusual oral sensations, bring it up at your next dental appointment. These aren't random. They're connected to your hormones, and they're manageable. Section 6. Stress hormones. Cortisol's war on your mouth. Now let's talk about something that affects every single person watching this video, regardless of age or gender. Stress. When you're stressed, chronically stressed, your adrenal glands pump out cortisol, and cortisol, while essential in short bursts, becomes destructive when it's elevated all the time. Here's what cortisol does to your mouth. 1. It suppresses your immune system. Your body's ability to fight off the bacteria that cause gum disease gets weakened. Studies consistently show that people under chronic psychological stress have higher rates of periodontal disease. 2. It promotes bruxism. Bruxism is the technical word for teeth grinding and clenching. Most people do it in their sleep and don't even realize it. Cortisol activates the nervous system in ways that increase muscle tension, including in the jaw. Over time, bruxism wears down enamel, cracks teeth, strains the TMJ joint, and causes chronic headaches. 3. It causes dry mouth. Cortisol interferes with the parasympathetic nervous system, which is responsible for salivary flow. Chronic stress equals less saliva equals more cavities. 4. It can trigger canker sores. Aphthous ulcers, those painful little sores inside the mouth, are strongly linked to psychological stress and immune dysregulation. Many people notice they flare up during particularly stressful periods. 5. Cortisol promotes inflammation systemically, and we already know that gum tissue is highly sensitive to inflammatory signals. The American Psychological Association's most recent Stress in America survey found that a majority of Americans report experiencing significant stress regularly, which means the oral health consequences are playing out in millions of mouths right now. Stress management isn't just good for your mental health, it's good for your teeth. Section 7. Diabetes, thyroid, and other hormonal conditions. We've covered the sex hormones and cortisol, but the hormonal story doesn't stop there. Diabetes, which involves insulin dysregulation, has one of the most well-documented relationships with oral health. The mouth-diabetes connection is bidirectional. Uncontrolled blood sugar increases susceptibility to gum disease, and gum disease makes it harder to control blood sugar. It's a feedback loop. Elevated glucose in the saliva feeds bacteria. Elevated blood sugar impairs immune cell function and reduces the body's ability to heal. Diabetics heal more slowly from dental procedures and are at significantly higher risk of infections. According to the CDC, adults with diabetes are nearly 3 times more likely to have severe gum disease compared to non-diabetics. Thyroid disorders are another important piece. The thyroid regulates metabolism, and hypothyroidism, underactive thyroid, is associated with delayed wound healing in the mouth, increased cavity susceptibility, macroglossia, an enlarged tongue, and in children, delayed tooth eruption. Hyperthyroidism, on the other hand, can accelerate bone loss and increase the risk of osteoporosis of the jaw, which ties back to everything we talked about in the menopause section. Hormonal disorders like PCOS, polycystic ovary syndrome, involve elevated androgens and insulin resistance, both of which have been linked to increased periodontal inflammation. The key takeaway here is this: if you have any hormonal condition, whether it's diabetes, thyroid disease, PCOS, or anything else, your oral health needs specific, tailored attention. Your dentist needs to know about your medical history. These systems are not separate. They talk to each other constantly. Section 8. What you can actually do. Practical protection. Okay, so we've covered a lot of ground, and I know some of this might feel a little overwhelming, but here's what I want you to walk away with. Practical tools. Number 1. Be a historian of your own mouth. Notice patterns. Do your gums bleed more at certain times of the month? Do you grind your teeth during busy work periods? These patterns are data. Write them down and share them with your dentist. Number 2. Tell your dentist about hormonal changes. Pregnancy, new birth control, menopause, a diabetes diagnosis, all of this is relevant clinical information. Your dental care should adapt to your hormonal context. Number 3. Address dry mouth proactively. If you experience dry mouth from menopause, medication, or stress, use alcohol-free mouth rinse, drink more water, consider xylitol products, and ask your dentist about prescription-strength fluoride. Number 4. Manage stress as a dental health strategy. Sleep, exercise, whatever works for you. Reducing cortisol isn't just about mental wellness, it's protecting your jaw and your gums. Number 5, don't skip dental cleanings during life transitions. Pregnancy, puberty, menopause, these are the most important times to maintain your dental appointments, not the times to put them off. Number 6, consider more frequent cleanings if you're high risk. Some people, particularly pregnant women, people with diabetes, and postmenopausal women, benefit from 3 or 4 cleanings per year rather than 2. Outro. Your mouth is not separate from the rest of your body. It never was. It's a window into your hormonal health, your stress levels, your immune system, and when those systems are under pressure, your mouth shows it first. The more you understand these connections, the better equipped you are to take care of yourself. And honestly, that's exactly why this channel exists. Drop a comment below. Tell me, did you know hormones affected your oral health, or was this brand new to you? I genuinely want to know. I'll see you in the next one. Take care of your mouth and your whole self.